demonstrate the basic principles of surgical asepsis used to establish a barrier between the procedure area and the outside environment. Scrubbing, gowning, and gloving. The barrier between the procedure area and the outside environment prevents the spread of microorganisms from the outside world to the patient and protects surgical personnel from blood and other body substances from the patient. Clothing requirements are based on recommended practices and guidelines of the Association of Operating Room Nurses, AORN. There are three general areas of potential contamination: the hair, nasopharynx, and skin. OR clothing should be freshly laundered and changed daily, and more frequently when contaminated. Head covers are worn to protect other garments from contamination. One-piece coveralls or two-piece pantsuits are acceptable. Tops should fit snugly or be tucked into the waist of the pants. Protective shoe covers may be required. Check agency policy. Jewelry such as rings, earrings, and necklaces are bacterial reservoirs and should not be worn in the OR. Scrub personnel should leave their watches in the locker room. Surgical masks with a 95% efficient filtration rate cover the nose and mouth and are worn at critical times of potential contamination. Depending upon individual preference and agency policy, a variety of masks may be available. Some masks have protective eye shields. Others have features to help prevent glasses from fogging during a procedure. Tie the mask securely to prevent slipping. Crimping the nose piece also helps secure the mask and ensures proper filtration. Surgical masks are changed after every procedure. Masks are removed by handling the strings only. Care should be taken to avoid contaminating the hands. Avoid touching the filter portion of the mask. A clean laboratory coat may cover surgical attire when it is necessary to leave the department. Upon return, it may be necessary to change surgical attire. Check agency policy. The purpose of surgical hand antisepsis is to remove as many microorganisms as possible, to minimize resident microorganisms, and to inhibit rebound growth. Two methods are used to accomplish this: traditional scrub and the use of antiseptic gel. Surgical hand antisepsis is required daily for all scrub personnel. Basic procedure guidelines are established by the Centers for Disease Control and agency policy. These include selecting the appropriate water temperature, pre-washing hands, wrists, and arms to remove gross debris and oils, cleaning nails under water to remove debris, keeping hands higher than elbows, scrubbing distal to proximal. A pre-wash precedes both the traditional scrub and the antiseptic gel application. Keep hands above the elbows at all times. Keeping hands above the elbows prevents water from dripping off the fingers and recontaminating the previously scrubbed areas. Clean nails and cuticles with a nail cleaner under running water. Traditional scrub uses antimicrobial soap. Follow manufacturer's instructions for duration of scrub, usually 2 to 6 minutes. Prepare the sterile brush. Using the sterile brush, scrub the thumb and all 4 fingernails. Scrub all 4 planes of each finger, following a side to back, to front, To side pattern to avoid touching scrubbed interdigital planes to non-scrubbed planes. With the fingers hyperextended, scrub the palm in a circular motion from the base of the fingers. Include the wrist. For the back of the hand, flex the fingers and scrub down. Include the wrist. Divide the arm into 3 sections. Beginning at the wrist with the first section, scrub all 4 planes of the arm. Then move to the middle section. Concluding with the third section, 1 brush width above the elbow. Discard the brush into the appropriate receptacle and rinse hands using the same order, fingers, hands, and arms. Dry hands thoroughly with a sterile towel in the same progressive order before gowning and gloving. After completing the pre-wash, prep the hands and arms with a brushless antiseptic alcohol-based gel. This rub provides persistent antimicrobial activity. Apply the alcohol-based product as needed to cover nails, fingers, hands, wrists, and arms to above the elbow. Allow the product to dry completely. Be sure to check agency for specific procedures. The gown and gloves are the final layers of the protective barrier. Gowning and gloving are done by either the closed or open method. Gloves are available in a variety of sizes and thickness. Hypoallergenic gloves are available as latex and with powder-free properties. The choice of glove depends on personal preference, availability, or agency policy. Gloving for the closed method is done individually, with hands remaining inside the gown sleeve until the gloves are donned. Gloving for the open method is done with or without assistance, hands outside the gown. To gown for either method, reach down and pick up the gown at the inside surface by the collar. Pick it straight up and stand away from the field. Unfold the gown by continuing to hold on to the inside neck portion of the gown and allowing the bottom portion to drop freely. Lift the entire gown up by holding it at arm's length from the body. Slip both arms into the sleeves, keeping the arms at shoulder's height. Allow the sleeves to continue to cover the arms and hands. The circulating nurse or other procedure room personnel will need to assist at this point. The circulating nurse ties the gown at the neck and the inside waist. The outside ties are secured when gloving is complete. The closed method of gowning and gloving assures that no bare skin is exposed during the procedure and provides for maximum sterility. To don gloves using the closed method, the hands remain inside the gown sleeve, above the cuff. Using the gown sleeves, turn the package so the glove fingers are pointing towards you and open the glove package. Using the dominant hand, cross over and pick up the dominant hand glove by its cuff with the gown cuff to cuff, aligning cuffs. Turn the hand and glove over palm side up. With the non-dominant hand still inside the gown sleeve, slowly pull the glove over the gown cuff. The cuff portion should be completely covered by the glove. Pull the sleeve and gown together as one unit. This allows the hand to slip into the glove. Repeat this procedure with the non-dominant hand. The gloved hand is used to assist. The closed method is preferred except when changing gloves during a procedure or when a gown is not required. To don gloves using the open method, the bare hands are exposed outside the gown cuff. This method is used when initially gowning, when changing gloves during a sterile procedure, or when the procedure does not require a gown. Gloves are donned individually or with an assistant. To don gloves with an assistant, using the open method, the bare hands are exposed and should not come in contact with the exterior of the gloves. Gown cuffs are considered contaminated once the original gowning is complete. Touching the exterior of the gloves will compromise the sterile barrier. An assistant prepares the glove package and picks up the right hand glove first under the inverted cuff. The palm of the glove now faces the person being gloved. The glove is stretched open and the bare hand is inserted into the glove. Lift up and stretch over the gown cuff, making sure the hands do not fall below waist level. Repeat the procedure for the left hand. If the sterility of the glove has been compromised during a procedure, this method is used to replace a contaminated glove. To don gloves without an assistant, using the open method, the hands are exposed outside the gown sleeve. With the glove package open, use the non-dominant hand to grasp the cuff of the dominant hand glove at the fold. Pick it straight up and stand away from the field. Insert the dominant hand into the glove, leaving the glove cuff turned down over the hand. Slip the fingers of the gloved hand under the folded cuff of the non-dominant glove. Pick it up and step back. Insert the non-dominant hand into the glove and adjust the cuffs. To complete the gowning and gloving procedure, make the final ties to the surgical gown. Untie the sterile ties in the front of the gown, hand the back tie to an assistant, and turn in a circle to secure the gown. Although a gown is considered sterile once it is donned, the back and any area below the sterile field are not considered sterile. At the conclusion of the procedure, the gown and gloves are removed in a manner that avoids cross-contamination of the arms, hands, and scrubbed clothes. When a gown is worn, the gown is always removed before the gloves to avoid contamination of the hands. To remove the gown, first untie the front tie. An assistant releases the neck, the back, and waist ties. Grab the gown at the shoulders and pull it over the gloved hands. Turn the gown inside out, being careful not to touch the scrubbed clothes. Remove the gown by folding it so the contaminated surface is on the inside. Roll and deposit it into a waste hamper. This ensures that any gross contamination will not soak through the laundry bag. The principles for removal of a disposable gown are the same as a non-disposable gown, or it may be torn off. Dispose in an appropriate container. To remove the gloves, use the left hand to grasp the right glove cuff on the outside of the glove. Invert the glove as it is pulled from the right hand. The fingers or the thumb of the right hand are then placed inside the cuff of the left glove, along the palm of the hand. The glove is inverted as it is removed. Sterile procedures prevent the spread of microorganisms from the outside world to the patient and protect personnel from blood and other body substances from the patient. Two members of the procedure team have demonstrated basic principles of surgical asepsis used in the procedure room, building barriers between the procedure room and the outside environment.